I'd like to welcome you to the newly diagnosed session. My name is Diane Bier. I am a caregiver. My husband does have an anaplastic astrocytoma, which is a grade 3 tumor. So I'd like to welcome all of you here today. These are just some of the topics we're going to talk about. We're going to talk about why me, what kind of resources are available to you, the side effects from various medications, or some of it is just side effects just from having a brain tumor, how you can cope with the diagnosis, and celebrating life. So one of the things that a lot of people may ask is, why me? And my husband David has a saying. He says, I don't have time for brain tumors. He says, I have too much to do in my life. And he has lived his life since he was diagnosed that way. He also has a saying that says, what fun is life if you cannot laugh? So for those of him that know him, he is truly a jokester. Always has a prank going or a funny comment, or he twists words around and is always making someone else laugh. Some of the things that happen when you are diagnosed with a brain tumor is you can feel overwhelmed. It's extremely shocking. Some people feel a little numb, and sometimes it's just not sure what to do. When my husband was diagnosed, it's a day I don't think I will ever forget, no matter how old I am or how many years have passed from the time he was diagnosed to now. And I felt personally almost like someone had slapped me across the face. And he actually made a joke about it, going back to being a jokester. I know, and Stan's laughing because he knows him. But when we were in the ER and the doctor came in and he said, you have a mass on your brain, David turned around and looked at him and said, we've all watched MASH, we've all watched ER, just say, I have a tumor in my head. And, you know, and the doctor's looking at him like, huh? But it is really shocking, and it can be overwhelming. And you step into a world that you never in a million years thought you were going to be stepping into. Sometimes people have a lot of negative feelings. And one of the things that you want to do is make sure that you can deal with and work through those negative feelings. You don't always have to be strong for other people. And you may be strong, and you may have days that you say, I'm good, I'm going to do this, this, and this, and you can go ahead and do it. But it doesn't mean that you're not going to have a day that comes along and you just don't feel like you're going to get through it. And those are the days that are hard. And you can say, I feel negative, this isn't right, why me, and so on. Just make sure that you do deal with those emotions as well. This particular page is various resources. The first one that I have on there is the New Jersey Brain Tumor Support Group. There are 2 groups in New Jersey. One is located in central New Jersey. The other one is located down in Monmouth and Ocean County. They are live support groups. You go, you meet people that have been diagnosed with some type of brain tumor. Both groups do meet once a month. You can go to one group, you can go to the other, you can go to both. But it is really important, I found, for us to be with other people that know exactly how you feel and they get it. And I'm sure you're going to hear that term over and over throughout today. They get it. They understand what you're going through and what you need to do to get through a day. The Musella Foundation is there, virtual trials. I cannot say enough about this particular website. Al Musella actually created this website and the Musella Foundation. For those of you that don't know, he has lost 4 or 5 family members to brain cancer. And when you go out to that website, he has links to everything. Every clinical trial that's going on in the United States is on that website, regardless of the hospital that it's being conducted at. And that's a really big point that I'd like to make, is you can come, and since we're at JFK today, I'm going to use JFK as an example. You can come in to JFK and they will give you the list of the clinical trials that they have going on in their hospital. They will not give you the list of trials, or they may not know of the trials that are going on at Columbia in New York City, or Cleveland Clinic out in Ohio, or at UCLA with Linda Liao. But if you go to virtual trials, all of the clinical trials that are going on throughout the US are listed there.
And Canada.
And Canada. Okay, so I think that's a really important site. The other one, there's a few others that I really do want to call out. The Stupid Cancer site. That is particularly for people that are in the teenage, middle teens to late 30s, and they will help that particular age group deal with a diagnosis of any cancer. So if you have a child, grandchild, anyone in that young adult phase that has been diagnosed with any type of cancer, it does not need to be brain cancer, any kind of cancer, they will help you with whatever information you need, they will have it. There's a couple of pediatric sites up here. Duke is on here. NIH. I want to spend a minute talking about NIH. I know the government's currently shut down right now. I know you can't get into anything right now for NIH for a trial. However, if the government is up and running and the very first time you go to NIH, you have to pay for your transportation there. That's the only thing, is the transportation. They will cover the doctor visits, any MRIs, anything like that. From the second visit on, they will cover your transportation as well as any housing. So if you're in California and you have to go to NIH for treatment, they will cover your plane fare, your housing, and getting you from the hotel to their center. So for those of you that have not been to NIH, NIH is huge. The very first time I went there, again, it was a tremendous shock. I want to use the expression, like, we were on this shuttle bus, and it's bigger than a college campus. Think of the largest college campus that you've ever been on. NIH, they have to be at least twice as big as that. What struck me was the fact that there was this huge campus, all dedicated to helping people in the United States with some type of cancer. And when you look at how large that campus was, that to me was what really, really bothered me, was that so many people in the US needed their help.
And don't know it.
And not even don't know about it. So I know right now that the government shut down. NIH is basically shut down. You can't get in for clinical trials or anything like that right now. But they have a great brain tumor center. So, and their care is free. You can go there for MRIs, you can go there for treatment, and so on. But the care is free. They will require you to have a doctor in your area, a local oncologist, or, you know, to help you, because if you live 4 or 5 hours from them and something goes wrong, you need to have a local doctor that's on your team. The other couple things that I do want to call out are Caring Bridge, Lots of Helping Hands, and Angel Food Ministries. So Caring Bridge is a website you can put up, and it's free. They are a nonprofit also. You can put up information either about yourself or whoever it is that you're taking care of that has been diagnosed with any type of illness. And people can go to your particular link, and you can put a blog up. You can write about how they're doing on a regular basis, 25 times a day if you want, once a month if you want. That's your choice. But the Caring Bridge site is there for you to use. And it's easier than making 25 phone calls. Take it from me. I have been there. I have done the 25 and the 50 phone calls. I'm really fortunate. My husband's 10 years out. But when he was first diagnosed, we didn't have a Caring Bridge. So I can tell you, I was on the phone 100 times. The other two sites that I want to talk about are Lots of Helping Hands and Angel Food Ministries. So Lots of Helping Hands. If you need help, you can go out to this website and list what you need. And you can tell your family and friends that the website is there and they will sign up for whatever it is. I need to get my kids to this activity. I need somebody to pick them up from school. I need somebody to get my spouse to the doctors. I need somebody to get them to radiation. Whatever it is, I need grocery shopping done. You can put it out there and your family and friends can go ahead and sign up. It's easier than you having to maintain a calendar.
See, this is good for those folks that say, well, tell me what I can do to help. You know, here, takes it away, you're telling them, and they go there and look at it and sign up for it. So,
Yeah.
Diane, I have a question.
Mhm.
They will actually take your patient to doctor's appointments?
Well, it's your family and friends that would sign up for it. So if you don't want to send out a million emails and maintain your own calendar, it's an online calendaring system that people can sign up for right there. The other one that I want to talk about is Angel Food Ministries. If anyone has ever had either themselves or a loved one that spent a tremendous amount of time in the hospital and you're caring for that person, it's very difficult to cook, especially if you have other family members. So Angel Food Ministries will help you with food preparation or what I call freezer meals, things like that. And the last but not least that's on here is the Randy Pausch video. For those of you that don't know, Randy Pausch was a professor at Carnegie Mellon. And he was diagnosed with pancreatic cancer a few years ago, and he did a last lecture. If you have an hour, watch the full lecture. If you only have 10 minutes, just watch the 10-minute video. It will be well worth your time. He was an incredible person. It doesn't matter that he wasn't diagnosed with brain cancer. The message that he gives is that it's really important to go and do the things that you love to do and to live your life. And even though you may have this diagnosis, whether we like it or not, it's been foisted on us and we have to live with it. And how you live your life is what is important. So there are definitely two versions. Like I said, the 10-minute version or the full hour. If you have the full hour, it is well worth the watch. It's really, really incredible. And the 10-minute one, if you only have 10 minutes, watch it. So this gets into what can I do or what do I do? Because when you're first diagnosed with a brain tumor or any kind of cancer at that point, most people don't know what to do. You're thrust into this whole new world and you basically have to learn to become a doctor overnight or speak their language overnight. One of the biggest things that I would really stress is, if at all possible, try to remain positive. Even if you have the worst diagnoses, try to remain positive. And to be your own advocate. It's really, really important because there is nobody that knows you better than you or your family. So be your own advocate. Build a team. And when I say build a team, I don't mean just go out and find a great surgeon. You can find a great surgeon, but if you hate him or you just don't get along, he is not for you. Okay? So it's kind of like a marriage, or it's like having kids. Find a team that you respect and find a team that is going to do their best by you. And that team is going to include multiple people. You'll have a surgeon if your tumor is operable. You're going to have a neuro-oncologist. You may or may not have a seizure doctor. You will probably have your general physician on there as well. That's just your medical team. And it's specifically for the brain tumor. It does not take into account if you have any other issues. So if you happen to have MS, or you have diabetes, or you have high blood pressure or heart issues, those people will also be on your medical team. In addition to having a medical team, you need to have a support team, so that when you're not at the hospital and you're at home, you have people that you can talk to and say, well, what do you think about this, and what do you think about that? And those team members can be your spouse or your family members or your parents, or if you go to church, your priest, your minister, your rabbi. Okay? You heard me say it earlier. I'm going to say it again. And if you are fortunate enough to be in an area where you can join a support group, join a live support group. If you can't, there are online support groups, because there are other people out there that have gone through this before you, and unfortunately there will be people that come after you. So the people that have come before you are usually more than willing to share their experiences, good or bad. And the one thing that you want to remember is that just because one person has this reaction or feels this way about something doesn't mean that that's how you are going to feel. So a doctor can say, I recommend drug A, and you can say, well, has anybody used this drug? What's it like? And the doctor can say to you, this drug has had really great results, no side effects, and all these other things. And you can go out and ask 10 different people, and you're going to get 10 different responses. So just keep that in mind when you make your decisions, that not everybody is going to have the exact same reaction or feeling about a particular drug. So when you're diagnosed, there is a standard of care. And the one thing I'm going to spend the next few minutes talking specifically about brain tumors. There are 120 different types of brain tumors, some more common than others, but there's over 120. So your standard of care for all of them are not going to be the same. It's also going to depend on what your pathology is. So when you are diagnosed, you want to do the standard of care before you do experimental. And the reason that we say that is because the standard of care is what has worked for the majority of people. So do what has worked for most people before you go and try something that has not been tried. Okay? The one thing that you absolutely need to have, whether your tumor is operable or inoperable, is the pathology. You can't treat the tumor until you know A, what type of tumor it is, and B, what grade it is. So if your tumor is inoperable, what they normally will do is what's called a biopsy. So they'll just do a little tiny hole, they'll take a tumor sample, they'll take some liquid, and then they'll do a pathology of it. If your tumor is operable, they don't normally do a biopsy and then surgery, because they have to go in and take it out. So they usually will go in, do the surgery, take it out, and then they'll do a pathology. So when you start going through getting your pathology and getting the name of your tumor and things like that, you actually want to take all of your medical records and put it in a folder or a binder, something, so that you always have it. Okay, it's really important that you keep a record of all of these things. When they talk about treatment, you're going to have your surgeon reports. If you go out on disability, you absolutely need to have these medical records, because disability will ask you for them. You need to know if you're going to have radiation or not. Some tumor types don't respond to radiation, and some do. There's multiple types of different kinds of radiation, so you need to know what kind of radiation you've had and how much, because they're technically, and I'll use the word technically right now, is a limit to the amount of radiation that you can have in a lifetime. However, recently, over the last few years, if there has been a tremendous amount of time between the first time you've had radiation and possibly a recurrence, they do look at a second session of radiation. So it's usually like 5-10 years. It's a big period of time. So in order for you to have radiation a second time, you need to know what you had the first time. So it's really important that you keep all of your medical records together and that you can go back and say, this is what I had. And you can, if you just take all the doctor's notes and put them in a folder, you should be good to go. Chemotherapy. So some people may or may not need chemo, and depending on the type of tumor and the grade of the tumor would determine if you need to have chemo. So is everyone aware of how they grade tumors 1 through 4? Yes, no? Okay, so 1 is considered benign, and then 4 is your highest grade. So whatever your grade is, you want to treat for the highest grade. So if they come back and they say you have a mixed oligoastro grade 2 or 3, you treat for grade 3. Okay? Make sure you keep all your doctor's appointments. And I'll talk about doctor's appointments in a few minutes. For those of you that are tech savvy, if you have your MRIs on CDs, back up your CDs. Make sure you have copies of them. Okay? For some of you that are, you may be many years out, and you have film MRIs. My husband has a mix. He has some on film, some on CD. He still has those original ones on film. And we used to have a huge portfolio case that we used to carry, and it weighed 1,000 pounds. And if you're really tech savvy and you have a scanner, scan all of your records into the PC this way, and make sure you back it up. Okay, I can't stress that enough. You can put everything on the PC, but if you don't back it up and your PC dies, then you have lost all your work. Okay, so doctor's appointments. Doctor's appointments can be really fun. Some doctors do not run on time. So if you want to get the most amount of appointments that run on time, book them first thing in the morning. Because as the day goes on, they run later. If you have a later appointment, bring books, magazines. If you're really into the celebrity gossip, you can, bring your People magazine, you can get caught up. After my husband was diagnosed, we went back for a follow-up visit with our surgeon, and my daughter at the time, she was only 15 months old, so we had her in a stroller, and I had someone taking care of my 2 older boys, and we sat in the doctor's office for 2 hours, 2.5 hours. I could have screamed. Loved the surgeon, and that's just the way he was. He would not let anybody else take care of his patients. He had to meet with everybody individually. So it was a long day. Keep a journal. One of the things that I tell people is sometimes when you write things down, you get it out of your head. So if you, whatever your feelings are, whatever your questions are, if you go in and you're prepared, and if you have 25 questions for the doctor, make sure you write them all down and just keep it in that journal. One of the things that you can do nowadays, cell phones have become really nice, is you can record your conversations. So if you don't have a tape recorder that you want to use specifically for doctor's appointments, record it on your phone. The reason I say to record it is because this way you can go back and hear what has been said if you're not 100% sure about something. So this way, if you tape record it, you can go back and listen to it again. The other thing that I do want to talk about is making sure you get all of your questions answered before you leave. It's really important. I know everyone puts doctors up on a pedestal. They have a tremendous amount of education. They have, they have had years and years of experience, and they don't always like to be questioned. but this is your life and how you are going to treat your diagnoses. And you need to make sure that you are comfortable with it. So if you have questions, make sure they are answered to your fullest satisfaction. And I keep stressing the your, because when you walk out of that doctor's office, if you're not sure about something, they're going to go on to the next patient. And I don't mean to be cold, and it sounds cold. They're going to go on to the next patient, but you're going to stand there and say, what about this or what about that? And you're going to have incomplete information to make a decision on. So make sure that you trust your doctors and that all of your questions are answered. If you have any prescriptions that need to be filled, get them filled when you're there. The other thing that I didn't talk about, and I just want to mention it briefly, is bringing someone with you. This goes back to the tape recording, is when you have an extra set of ears or an extra set of eyes and you want to make a decision about something, it's good for that person that you're going to talk about to have heard what was said.
Because both of you will probably hear something different, a little different,
Yeah.
hear a different way. You've had it so many times.
And the other thing that's really important is that if it's, let's say it's myself that had the diagnoses, I mean, the whole family's emotionally involved, but some people don't want to hear what is being said. So, and my dad said that to me. He was diagnosed with prostate cancer a few years ago, and he said he would go to the doctors. He said, I couldn't hear what they had to say. He said, I just shut down in there. He loved his doctors, but he shut down. So, you know, and it is hard when the doctor says, well, I can't do this, but I can do this, and maybe you don't want to do that. That's okay too. So this is a medication sheet, and it's really important that you know what meds you are on. And I'm not talking just the brain tumor, because most people nowadays don't have just one thing. They may have diabetes, they may have MS, or they may have a heart condition, or, you know, or another type of cancer. Not all brain tumors are a primary brain tumor. Primary brain tumor meaning that the tumor started in your brain first. Secondary brain tumor is when the cancer starts elsewhere in your body and goes to the brain. Most cancers that start elsewhere in the body, if it is going to metastasize and go elsewhere, 20% of the time it goes to the brain. So for me, that's a pretty high percentage. So you want to make sure that you know what medication it is that you're taking, even if you take something as simple as a daily vitamin. So if you have a hard time remembering what to take and when to take, you can have a medication sheet and you can leave it on your counter or on your refrigerator, and you can just check off 8 a.m., 12 p.m., 6 p.m., and so on. The other thing you can do is, you know those little pill boxes? Okay, and they're broken down into days or AM and PM, or they have a week or a month's worth. You can put your pills in that and you can just take out what you need for that day or that time. Okay. The other thing that it's really important to know what medications you're on is because if you're taking a medication for A and the doctor recommends chemo, you need to know how they're going to interact. Or if you're taking medication A and you have seizures, your anti-seizure medication may interfere with drug A or the other way around. So usually this one will interfere with your anti-seizure meds.
And I would recommend keeping the sheets, like a history of them, because, let's say next year they want to put you on something. I said, well, we already tried that. Here, we did that, so-and-so. You know, so we always kept those sheets, so
Yep.
we knew what he was doing at whatever time.
So for standard of care, we want to try what works first and foremost for the majority of people. Before we try something that's experimental or, you know, does not have a long track record. And depending on the type of tumor you have, depends on what the standard of care is. So if you have an anaplastic astrocytoma, an AA, which is an astrocytoma grade 3, or you have a glioblastoma, which is also known as a GBM, that's an astrocytoma grade 4, or you have an oligo, each one of those tumor types would be treated differently. Okay? So an AA and a GBM are an astrocytoma grade 3 and grade 4. You may not treat that GBM the same as you would the AA. And it's not just the tumor type and the grade, it also depends on the location. So if I have a tumor here and it's operable, they can go in and take it. If it's here on my midline shift and it spreads over the two, most of the time they're not going to operate. So the standard of care is going to be different for each one. The other thing that I really want to stress is to get a second opinion. So if you're not comfortable with what your doctor is telling you, go get a second opinion. It doesn't cost you anything. Your time. Your time. So find a brain tumor center that's close to you and try and see if you can be treated there. JFK has a brain tumor center. There's one Cleveland Clinic. You have NIH, you have Duke, you have UCLA. There's Cedars-Sinai out in California. There's, I forget the name of the hospital in Seattle. You've got MD Anderson down in Texas. So there are many more brain tumor centers today than there were 10 years ago when my husband was diagnosed. So when my husband was diagnosed, I think there were 3 or 4 that I knew of off the top of my head. And I don't know about the number now, but when he was first diagnosed, there was probably 80 or 87, I don't remember the exact number, of neuro-oncologists practicing in the United States. And that number now has dramatically increased. The same as the brain tumor centers have increased in number also. So that means that the brain tumor patients can get better care and better treatment, hopefully closer to where they live, as opposed to having to travel 3/4 of the way across the country. So when we talk standard of care, it's surgery or biopsy, okay, depending on if the tumor is operable or not. Depending on the type of tumor, you could have radiation or chemotherapy. You could also have vaccines. So there are vaccines. Most of the vaccines, not all of them, but most of the vaccines are for your GBMs, your higher grade tumors, and they have proven to be very successful. Up until the last couple of years, the majority of those vaccine trials had to be newly diagnosed. So the second you were diagnosed, then you could have the vaccine. If you were diagnosed, had surgery, and 2 days later found out about the vaccine, it was too late. It was literally, at that point, too late. And there were no vaccine trials for recurrences. So today, Cedars-Sinai has had very good success with vaccine trials on recurring GBMs. They happen to be out in California. I know we're in New Jersey. They're not around the corner, but the vaccine, the point I want to make is that the vaccine trials for recurring brain tumors are becoming more available. You do not have to have it first time around. Because one of the things that I found is that when you are first diagnosed and you're thrust into this world, nobody knows about, you got to have this now first time. Unless you're in UCLA. Because Linda Liao is the leader in that particular area, the vaccines. You also have Avastin and Novocure. So I want to spend a minute talking about Avastin. Avastin is not a chemotherapy. It's an antigenesis. And it's been used in the breast cancer world for many, many years. And around 2007, it came into the brain tumor world as either used alone or in conjunction with the chemo. And it's gone through clinical trials, and they now do use it for GBMs. There has been a lot of mixed about it. So before you say yes to Avastin or any drug for that matter, just get all of the ins and outs on that particular drug. Okay? The side effects, everything. How long should you stay on it? What does it do to the tumor? Does it keep your tumor small, or does it diffuse the tumor? So these are all questions that you would want to ask your doctor. And just so you know, I know everybody says a tumor and they think a tumor is like this, like a fist. You go in, you take it out. A lot of brain cancers or brain tumors are not a fist that you can just go in and take out. So you have what they call diffuse tumors. They're kind of like starfish or something like that. So you can have like a good cell here, a cancer cell here, a good cell here, 2 more cancer cells, a good cell. So it's all mixed. So when they go in and they take that tumor out, they're taking out good cells as well as the tumor cells. So it's a little different than, a tumor that you might get here where you can just go in and take the whole thing out and it's just, all tumor. So brain tumors are not necessarily a solid mass. Okay, on the bottom, I want to spend a minute talking about clinical trials. Vaccines, some of them are still in clinical trials. The ones for recurrences are in clinical trials, but they have shown to have some good prognoses, which is good. Novacure is a device. There's actually one out on the table, and there is a table in the back of the main room. And what they do is, if you don't mind losing your hair, they put these magnetic devices on your head, and you carry around a little bag with you, and it goes in and it starts to shrink your tumor through magnetic doses. Okay? And the last one and just clinical trials in general. There's lots and lots of clinical trials. I had a website up earlier, virtualtrials.com. If you want to know all of the clinical trials in the US and Canada, go to that website. Al also happens to have all the support groups in the United States and Canada. He has an online support group. He has a Facebook page. So very socially aware. So side effects. Side effects, you have multiple side effects. You have side effects from surgery. You have side effects from seizures. You can have side effects from chemo or your memory issues. Memory issues is a side effect from surgery. It's not a drug-induced one, but it is definitely something that you have to live with. Anybody in here get seizures? So I want to spend a couple minutes talking about seizures. Seizures, your anti-seizure meds, you want to take at the same time every single day. So if you always take it at 11 o'clock, 5 o'clock, and 10 o'clock at night, always take it at that time. Don't change it. And along with that, just some crazy things. So stress will help bring on seizures. And one of the things that you want to do is keep the stress level down. And I know that's really an oxymoron when you say, I've just been diagnosed with a brain tumor. I have to go through surgery. You're telling me I need radiation. Oh, and by the way, you have this kind of tumor, so I think you should have this chemo and these other 2. No, stress, right? So try to keep the stress, and we laugh, to a minimum. There's other things, like go to bed at the same time every day. Get up at the same time every day. And it sounds like, oh my God, I'm a kid. You're going to put me to bed. I'm going to get up. I'm going to be a very scheduled person. Yes, you are. You're going to be a very scheduled person. You're going to be scheduled from the doctors. You're going to be scheduled for your meds. Everything's going to be scheduled. But when you have seizures, if you can keep everything as much as possible on a routine, it will help eliminate the seizures. And that's the goal. The other thing with seizures is do not take them with any type of citrus. No orange juice, no lemon juice, no grapefruit juice, nothing. There is something about citrus and anti-seizure meds, they don't mix, and the citrus actually will cut the anti-seizure meds in half. So just try to stay away from that. I just want to make sure. Oh, the other thing that I want to talk about with the anti-seizure is that there are many different types of anti-seizure meds. If one doesn't work, find another drug. And if you have trouble with multiple drugs, then my recommendation would be to go to an epilepsy doctor, someone that specializes in seizures. I just want to spend another minute on the anti-seizure drugs. If you feel that a particular drug is not working or is not helping, I don't care what you do. If you have to stand on your head, jump through the ceiling, have a temper tantrum like a child in the doctor's office, it doesn't matter. Make the doctor understand that they have to change the drug. Okay, my husband had a lot of issues with one of the anti-seizure meds, and they would up it, and the seizures would level off for a couple of weeks, and then it would go back to exactly the way it was, and they would up it again, and it would go back. And we went through this for a long time, and then it just got to the point where I said, he needs to come off of this. Nobody would listen to us. Nobody. They thought I was nuts. Finally found a doctor that said, yes, you're right, he shouldn't be on that drug. Thank you. Hello. The other thing with seizures is that there's a new procedure now where they can actually take out, Peggy, I don't know if you want to spend a minute talking about this, because I know John had it, where they take out the piece that's actually causing the seizures, the neurons that cause the seizure. Yeah. So if the drugs don't work, it's always an option.
That was called grid surgery.
Yeah. The other thing that I want to spend a minute talking about is radiation and chemo. Radiation, if they say, oh, you'll be tired, just a little tired, some people can be very tired, and some people just need a 15-minute nap at lunchtime, and they're good to go. So that goes back to everybody's a little different. And on chemo. If they put you on chemo and they give you an anti-nausea drug and it doesn't work, say to the doctor, this doesn't work, give me something else. There's millions and millions of anti-nausea drugs. If one doesn't work, you're going to find one that does. And the other thing that I want to spend a minute talking about is how you feel about having to go through all of these things and coping with it. And I know a lot of people don't want to say, I'm depressed, I can't handle it. But you know what? There's drugs out there for that. If you have a headache, what do you take? Advil, aspirin, Tylenol, and it's made just for that, right? Okay, so if you don't feel like doing anything and you are feeling depressed because of your diagnoses and what you have to go through, and I think that's a pretty normal reaction, tell the doctor and say, give me something. There's no reason why you can't take that just like you would take an Advil or Tylenol or an aspirin. That's why they make them. So, quality of life. It's really important that you take time for yourself, be it the patient or be it the caregiver. You need to do things that you love to do. So even if it's only 15, 20 minutes or half an hour a day, make sure you take some of that time for yourself. Whether it's a walk, a cup of tea, reading a book, it doesn't matter. Take a little bit of time for yourself to step back from everything that you have to deal with. Make sure you get enough sleep. Okay, I know everybody says, yeah, right, you know, and nobody sleeps well when they're stressed and when they're worried, but it will really help you to feel better and make better decisions. So when you eat nutritionally dense foods and when you get enough sleep, you can make better decisions. If one of your ways of releasing stress is to go and run or take a yoga class, do that. Because when you exercise, then it builds the serotonins in your brain, and one of the benefits of that is sleeping better. So even if you only sleep 6 hours, but you get a good 6 hours of solid rest, that's better than 8 hours of tossing and turning. Okay, so coping with this new normal. So the first year is going to be stressful, unfortunately, and everything's going to be turned upside down. But you will get through it. And the new normal is going to change probably at least 3 times the first year, at least. So you're going to have a new normal when you're diagnosed. And if you have to have surgery, you're going to be in the hospital, and that means a change in everybody's routine and schedule. When you come home from surgery and they tell you that you need radiation, the normal radiation is 4 to 6 weeks, every single day, 5 days a week. So then you're going to get yourself or your spouse or your loved one, whoever, your child, back and forth to radiation every single day for that time period. And then you're not going to go to radiation anymore like, oh my God, I have a couple hours extra every single day. Oh, now I have to go for chemo. Okay, so that's only once a month, but I can deal with that. Oh, I'm going to have Temodar, which is a pill chemo. I don't even have to go to the hospital. Even better. So that normal is going to change multiple times the first year, and if there's any recurrence or anything like that, it's going to change again. Break it down and try and take it a day at a time. So if you find that looking at a 24-hour time period is overwhelming, break it down. Break it down to the morning. Break it down to the afternoon. Break it down to dinner time. And try to get through chunks of a day instead of looking at the entire day. Because sometimes when you look at the big picture or everything that's got to get done that day, it can be really overwhelming. Keep a list of who does what. So if you can maintain a calendar, or you can use Lots of Helping Hands, which was a website that I had up earlier, do that. If you have to talk to young children, when my husband was diagnosed, my kids were really little. My daughter was 15 months old, and the boys were in 1st and 3rd grade. They were pretty young. What we did was we kept their schedule as normal as possible. And instead of using these big words that the doctors used, it was, Daddy's got something in his brain that that's not supposed to be there, and they're going to take it out. And keep hospital visits with kids really short, like 10 to 15 minutes. I know for, caregivers and spouses, that's hard because you want to go there and be there. The kids want to make sure that their mom or their dad is okay, but they can't handle a 3-hour hospital visit. So it means that somebody's got to do a lot of extra driving and picking up. So you pick them up, they're in, 15 minutes later, they're out. Use email. Email's a wonderful thing. I used to send out, I call them blast emails. I need somebody to do this, this, and this. I need somebody to come watch the kids from 8 o'clock until 10 o'clock so that I can go to the hospital. And I would have the kids ready for bed, all of that, or whatever it is you need. I need somebody to do the laundry. I need somebody to do the grocery shopping. Those kinds of things. The other thing that I think is really important is find those long-term survivors. Find out what they did to be successful. Find those people that are 10, 15 years out. Now, I know on a GBM, there's not a lot of people that are 15 years out. It just is not the normal. But the one thing that you want to remember is that when the doctors say, oh, gee, I'm really sorry, but you have 65 weeks left to live. Me? I mean, I'm a pain in the neck. I'll be quite frank. I'm a pain in the neck. I'd be screaming, what do you mean I have 55 or 65 weeks to live? You're not telling me that. And I don't care. I'll be screaming, you better come up with something that's going to give me more than, 50 weeks. That's just, my terminology is not acceptable. Not acceptable. If somebody told you that was your diagnosis, what would you do? Who would you go to? That's what I want to do. Go find those people that are 10, 15 years out. You go back in that main conference room today, start asking around. How many years out are you? Because I can guarantee you there's people in there that are, you're 8 years out now? Okay, Victor's sitting in the back, 7 years out on a GBM. Okay? My husband will be 11 years out this December with an AA. Okay, it's a grade 3 Astro. Flo, is she here yet? Flo's got to be like 15 years out.
I think about 17.
17 years out. Bruce Blount and Nancy Conlevin are both high teens or low 20s, years out. Matthew Zachary is in there. He's 20 some odd years out, or close to it. Mary Ellen Sullivan's in there, 12 plus years out. Go find those people. Find out what they did. I'm not there yet. Go find those people that are a lot of years out. Ask for what you need, okay? Whatever it is you need, it would be reasonable and people will give it to you. That is one of my life sayings. Ask for what you need, okay? Whatever you can offload, cooking, cleaning, laundry, do it. A lot of supermarkets now have online. Order, let them deliver. I know it's a $10 or $15 charge, but you know what? It saves you the 3 hours of having to go there. Offload it. Anything, same thing on childcare. If somebody's willing to pick up your kids and take them to their activities, let them. So this is really important. You want to stay positive. You want to be your own advocate. You want to be the exception. So you want to tell everyone, I am going to be the exception to this. The doctor may say you have X number of weeks. It's a number. It's no different than your age, your weight, your eye color. It is a number. And just look at it that way. It's a number. I'm going to be the exception. Somebody has to be the exception. Why not you? Have a sense of humor. Okay, I can't stress it enough. I really think that really truly does help people get through things. Become your own brain tumor advocate. There's a lot of people in that main room. If you go around and you ask, there's a lot of people in that main room that have lost loved ones. And they are all here today to make it better for people coming forward, because unfortunately, there are people that have been before me, and unfortunately there's going to be people that come behind me. And it's a fact of life. I can't change it. I wish I could. So the one thing that's really important is that you want to thrive. Where's my one slide? I want to show this slide. So a couple of things that I want to talk about on this slide is those 4 people that are over there are all brain tumor survivors. Okay? Jenny McDevitt did pass away 2 years ago, but she used to run marathons on chemo. So full marathons, 26 miles. My husband David is there. He does a half marathon. Joel runs marathons. And Flo, who is down here skydiving, okay, is 17 or 20 years out. Okay, and she's my age. She's well in her 50s.
She's old.
So, you know what? They're not all 15, 16, 20 years old. These are people that are in their 20s, 30s, 40s, 50s, 60s that go out and live. Go and live. Okay, so I'm going to spend 2 minutes talking about this particular slide. Jimmy Fong was a member of our support group, and if I start to cry, I apologize. And he had a saying, and he said, whether you have 50 years or 5 minutes, live your best life. And that's it. Attitude determines altitude in life. And he did just that.
Thank you very much.
You're welcome.